Hello, my name is Kayla Scappaticcio, and I will be performing a head-to-toe assessment today. Before entering the room, I will knock on the patient's door, perform hand hygiene, follow my general principles and safety practices, and provide privacy. General survey of the room, making sure that there is no safety hazards for my patient, noting any IVs, any drainage tubes, any catheters, the overall appearance of my patient. She doesn't seem to be short of breath, have any anxiety, she's not grimacing, she doesn't seem to be in pain. Her skin matches her ethnicity. My name is Kayla Scappaticcio. I'll be your nurse today. What is your name and date of birth?
Courtney Bays, 12/10/95.
May I look at your wristband? I'll be performing a head-to-toe assessment today. Is that okay with you?
Mm-hmm.
And I'm just going to ask you some general questions. Are you in any pain today?
No.
Do you have any allergies?
No.
Are you on any medication, herbal supplements, or over-the-counter?
No.
Do you have any medical history that I should be aware of?
No.
Do you have any insurance?
Yes.
Do you have a primary care provider?
Yes.
Do you have transportation to and from the doctor?
Yes.
Do you have means to get and keep food?
Yes.
Do you have means to keep the utilities on?
Yes.
Do you have income?
Yes.
Do you feel safe in your home?
Yes.
Have you been vaccinated?
Yes.
Do you have any religious beliefs that would affect your care today?
Mm-mm.
Do you have any activities you do outside the home, community projects, anything like that?
Yes.
Okay, and do you need any help today with any utilities or any services?
No.
Okay, let's get into the general assessment. I'm going to now take my patient's vitals, making sure that the blood pressure cuff is the appropriate size for my patient. Taking her temperature under her tongue, and her temperature is 98.8. Oxygen is 98. Blood pressure is 120/80. Checking the pulse, and they're symmetrical, and her respirations are 18. Now, may I take your hair clip down?
Mm-hmm.
I'm going to assess my patient's head and skull. Skin is intact. The skull is free from any abnormalities, any lumps. The skin is pink, warm and dry. Her hair is clean, not brittle, free from any infestation, and the size and symmetry is appropriate for the patient. Moving on to the ears. The ears are bilateral, have bilateral symmetry. There is no drainage, no excess wax, and no foreign objects. Do you wear any hearing aids?
No.
Noting that the patient's ears are pierced. Can you repeat that to me?
1, 2, 3, 4.
Good.
1, 2, 3, 4.
Okay, the patient's speech is clear, not slurred, and has no impediments. Moving on to the patient's face, it is symmetrical. She has good eye contact. Can you raise your eyebrows for me? Awesome. Puff out your cheeks. Smile. Great. Her skin is warm and pink and dry. There's no lesions, no scars, no abnormalities, no facial swelling. Noting perla of the pupils are symmetric and reactive to light. I'm going to look in my patient's nostrils. They are symmetrical, no drainage, no lesions. Look in the patient's mouth. Can you stick out your tongue for me? And say, ah. The oral mucosa is pink and moist, free from any lesions or ulcers, and teeth are intact. Moving down the neck, feeling for any swollen lymph nodes. Is there any pain? Moving down the clavicle, pinching her, checking her skin turgor. It bounces back appropriately. No signs of dehydration. Can you swallow for me? Great. Can you lift your head up and then your chin back down to your chest? Move your head to the right and then to the left. Can you brace on my hand? Great. Can you brace on this hand? Awesome. Okay, now I'll be moving towards back. Can you lean forward for me? I'm checking symmetry of the back, making sure there's no lesions, no skin breakdowns, no abnormalities, no abrasions, paying close attention to the sacral area, making sure there's no skin breakdown, no irritation, inflammation. Do you have a history of sacral skin breakdown or irritation? Okay. I'll ask my patients, could you stand up and walk across the room for me? Thank you. Can you walk back to the chair? Patient's gait is good. She seems stable. I will now move on to my patient's arms. Her skin is warm, dry, and pink. There seems to be no edema, no lesions, no scars, no bruising, no abnormalities. There's no edema in the hands or the fingers. Can you move your hands for me? I'm going to check the capillary refill in her fingertips, and that is in her nail beds, and that is less than 2. Can you lift your arms up for me? Thank you, and down to your side, and put it back down. That's awesome. Can you brace against my hands? Push down on them, and then brace and squeeze my hands. Awesome. Excuse me. Noting that the patient has no facial hair as well. I'll be checking the patient's legs. I will be assessing her legs bilaterally, making sure that there is no swelling, no lesions, no abrasions, making sure that they are symmetrical. Can you lift your leg up for me? Awesome. Noting any popping or cracking in the knees. Was that painful? Lifting this leg up, noting any popping, cracking in the knees. Was that painful? Okay. I'll be checking the pedal pulses, making sure that they are symmetrical, and they are. I'm going to check the patient's heels for any heel breakdown, any lesions, any abnormalities, any irritation, and the patient does not have any irritation. Can you press down on the pedals for me of my hands? Thank you. And then brace back up. Awesome. Is there anything else that I can do for you today?
No, I'm good.
Okay, before leaving the room, I would make sure that my patient is comfortable and safe. If they are in a bed, I would provide the call light within reach, bed rails up, bed in the lowest position. I would then sanitize my hands before leaving, report and document. And that concludes my head to toe assessment.